Hi, everyone. Thanks for joining us this afternoon. I'm going to get started in just a few more seconds here while I wait for everyone to get logged on. Looks like a slow roll of you guys joining us, which is great, but just want to make sure I hang on until you all get logged on before I start talking too much. So just hang tight for a minute. All right. Looks like everyone's had the chance to connect. So welcome to today's information session on our School of Optometry program here at Massachusetts College of Pharmacy and Health Sciences. My name is Hannah Campbell. I'm a Senior Assistant Director of Admission here at the university. And I primarily work with candidates that are applying to our optometry program. So you'll likely be working with me throughout the entire process. So nice to see you all today. I'm also joined here with a couple of our current students, Sierra and Samir. So if you guys would want to introduce yourselves real quick, that'd be great.
I'm Samir. I'm a current third-year optometry student. I'm from Canada.
I'm Sierra. I'm a second-year optometry student, and I am from New Haven, Connecticut.
Thank you, guys. So we're pleased to be here this afternoon to talk to you about the School of Optometry at MCPHS. And during this info session, we're going to talk not only about the university and the optometry program that we offer, but also about how you can apply. And then we're also going to finish up with a Q&A session to answer any last questions that you might have that we weren't able to address in the presentation itself. So if there's a question that comes to mind, you're welcome to submit that in the Q&A box at the corner of your screen for us to address at the end. And also note that this webinar is being recorded. So if at any point you need to log out before the end, I'm going to distribute this recording to everyone who registered by the end of the week. So you can keep an eye out for that link. So without further ado, let's get started. So starting with just some basic information about MCPHS and our legacy, we are a healthcare specific university, really hence our name. We've been around for quite a long time. We just celebrated our 200th year anniversary in 2023. So in that 200-year period, we have grown to offer over 100 programs in healthcare and the health sciences. So that's really our specialty. And with that, we started as just a pharmacy program in Boston back in 1823. And we are actually the oldest institution for higher education in Boston, but have since expanded quite a lot. So these days we have 3 physical campuses and an online basis as well, which we'll get into a little bit more on the next slide to break that down. But over that 200-year legacy, we've had the opportunity to sort of build and maintain some clinical affiliations with some of the leading medical institutions in the nation. So when it does come time to choosing your externship sites, we really have no shortage of options. We have sites that are as far west as Alaska and California, as far south as Texas and Florida, and really everywhere in between. So if you want to have your shot at visiting a different state during your externships, we can certainly make that happen for you, and you will work with a clinical coordinator on those sites. So further breaking down our locations, so I started mentioning our Boston campus. So that is our flagship campus, essentially, the one that started in 1823 as just a pharmacy program, but now it is more so our undergraduate campus. That's where we do have a couple of graduate programs, but for the most part, it is where you'll find, students in a 4-year undergraduate program. And then we added our Worcester campus in the year 2000 and Manchester, New Hampshire campus in 2002. These 2 campuses are strictly professional phased healthcare programs only. And then we also have a robust catalog of online programs that students can take advantage of, which we'll kind of mention as we talk about some of the program features as we go on, because you will have the opportunity to tack on a Master of Public Health through MCPHS online while you are in the program with us. So let's speak about Worcester in a bit more detail. This is specifically where our optometry program takes place, our Worcester campus. And that is how you pronounce that. That city name is Worcester. We've heard kind of everything under the sun in terms of pronunciations. So no worries if you don't get it right the first time. We really don't even pronounce it correctly ourselves half the time. I often hear it referred to as Worcester if you speak to a local, switching out the ER for an AH as the Boston accent often allows. So, do your best at pronouncing it. It's fine. So with the Worcester campus, this is actually the second largest city in New England behind Boston, of course. And it's an area where you're just going to find healthcare right at your fingertips. So right like visible from our front steps is St. Vincent's Hospital, and that's where a lot of our students will have clinical rotations. Not necessarily our optometry students, but some of our other students will. But about 2 miles down the street from us is UMass Memorial Medical Center, and they have a medical school with an ophthalmology program, and that is a good partnership that we've been able to form in the city of Worcester, because we not only refer some of our more complex patient cases over to them, but our students have participated in some research opportunities with them as well, which we'll get into a little bit more throughout this presentation. So other than that, this has been a really up and coming city. It's seen a lot of growth over the last couple of decades. It's kind of been known to be going through its Renaissance period. And with that, it's become a college town, essentially. There's 11 other colleges and universities in the area, and there's a lot of entertainment that has come to the city. You can see, 2 different sports teams within the city of Worcester. There's it's the Worcester Palladium, which is where you can see like indie bands, and then there's the Hanover Theater, where you can see Broadway shows, and Mechanics Hall, where you can see symphony orchestras, and the DCU Center, where monster trucks and Cirque du Soleil will come through. Those all really border our campus in the downtown Worcester area. So there's always something fun to do. Our students often get free tickets to the sports games that happen in the city, especially when they have like a college night and bring out all the college students from the area. So it definitely is a fun environment to be a part of. You're also never going to have a bad meal here. But since I have 2 students join here with us, I'd love to get their perspective on some of the fun things that they like to do in the city of Worcester when they have the time.
So I guess I'm from Canada, so it's like a completely new kind of experience for me. But in the past like 2.5, or I guess maybe 3 years, we've mainly explored like the different types of restaurants that are available. As Hannah did mention, there's like a different, like quite a big variety of different food options. You will find a McDonald's everywhere, but you won't find like the local different bakeries, cafes, and like mom and pop like stores and shops in Worcester. So it is like a great opportunity to experience the different foods available, and they're pretty much very like close by to the main 10 Lincoln building. So maybe like a max 15-minute walk either direction, you'll find a wide variety of them. Other than that, across again like the main 10 Lincoln building, we do have a bar arcade available that's open pretty much I think every day in the evenings. They have arcade games, different like bar type foods. And then with that, Boston again is like about an hour and a half train ride, an hour car ride away. So you can always go there. And that's what we've usually have done in the past too.
Yeah, I would have to echo. The restaurants are definitely a big hit in Worcester. I actually went to undergrad in Worcester, and I feel like I'm still discovering new restaurants like 6 years later. So there's definitely no shortage in Worcester. I also like a little more of the adventure side of Worcester. I've done ice skating, rock climbing, definitely a lot of those Woo Sox games, that Red Sox affiliate team that Hannah had mentioned. So there's a lot of different ways to also just kind of get out in Worcester and experience something new.
Thank you guys for sharing. I think it's also important to note that the city is pretty accessible too. So if you had like a free weekend and wanted to like go to the beach or the mountains or the lakes region, we're really connected quite well through the highways that run in and out of the city. You pretty much can get to any New England state from Worcester in about an hour or less. So if you want to travel around, it's pretty easy to get there. And we also have a commuter rail station that is maybe 10-minute walk from our campus. It's Union Station. You can take commuter rail directly in and out of Boston. There's also an Amtrak that runs through it. So you can take a quick trip to like New York City for spring break or something like that. So very well connected city in terms of transportation. And you'll also have no shortage of things to do when you do have the free time and when you're able to find it, which is why our students like to partake in a lot of the finer cuisine in the city because it's easy to get away. You got to eat at some point, right? And one interesting thing that is a bit unique to our program is that we do offer on-campus housing here. So even though we are a graduate program, we do have on-campus housing that is available to our population. So for the most part, our campus is graduate level students, although we have a couple programs that do allow transfer students. Such as like dental hygiene and diagnostic medical sonography. But most everyone that comes here has a bachelor's degree, so it creates a really mature on-campus living environment. And we have quite a variety of options for you to choose from. Everything is like maximum a 10 to 15-minute walking distance to where the optometry program takes place out of. So it's pretty convenient for students. Everything does include utilities. It does come furnished. And we have even like studio units or 1-bedroom units through 2-bedroom apartments. So you can really opt for whichever residence really suits your interest. And Samir actually is a resident at our Lincoln Square housing accommodation, which is in the same building where our optometry program takes place. So Samir, I'd love to hear your perspective of what it's been like for you to live on campus.
For sure. So in undergrad, I actually commuted, so I didn't really have like the typical like undergrad living off campus experience. But given I am not close to home, I decided this was probably the best option. I really wanted to have my own bathroom and like my own space, of course. And then at the same time, it was convenient because if not majority or all of your classes, labs, and clinics like within the optometry program are held in the 10 Lincoln Square building. So it is very convenient to kind of just get up in the morning, get ready, and then come back down to class. At the same time, you're kind of avoiding like the rain and the snow, which I hate. So it is convenient in that sense. However, with that, there are different like limitations. You are having to like use a community shared kitchen with all the residents who live in 10 Lincoln, whereas other apartment style or like different residence options have their own kitchen, sorry, but they may have roommates or like other different options that are available with that.
Great, thank you so much. So there is a variety of different price points that we do offer and a variety of options as well. So there's 5 different residential areas with a variety of different unit types. So if you wanted to explore those that suit your interest best, you're welcome to take a look at those on our website. We'd be happy to discuss that in more detail with you too. So this is a snapshot of the community that takes place here on our Worcester campus. So we have a variety of doctoral master's programs and like kind of post-bac type programs as well. So this is who you can expect to have on campus with you at any given time. The only programs that don't take place in the same building where our optometry program takes place is nursing, pharmacy, and acupuncture. They're just about a 5-minute walk down the street in our Foster Street buildings. But everyone else has their program in the same building as you guys. So we really are a healthcare centric community. And several of these programs do actually have functioning on-campus clinics that serve members of our community. So that would be for our physical therapy program, our dental hygiene program, our acupuncture program, and of course, our optometry program. So you're not only going to be seeing patients yourself, but also your fellow classmates will too. And you might be able to partake in some of those healthcare services while you're a student with us. It is very common where you might have a dental hygiene student come up to you and be like, hey, I really need to clean someone's teeth today. Can you be my patient? And then you can be like, yeah, sure, but you got to let me check your eyes next week or whatnot. So it's nice to take care of your own healthcare while you have the opportunity to do so as a student and also help your fellow community as they progress through their own program. And it might be an interesting opportunity for you to try acupuncture for the first time if you haven't yet. And since we are a healthcare specific community, at least once a semester, we bring all of these programs together to participate in what we call interprofessional education. Interprofessional education, or IPE, is something that's really become a part of the university's mission, because we really want to graduate healthcare professionals that are equipped to collaborate with each other and have a better understanding of the spectrum of healthcare services. So we bring everyone together for sort of like a group learning activity, a seminar, or a case study. And you guys get to work with patients from like different cultures or understand better how to work with patients from different cultures and backgrounds, and how to work as a team when employed in the healthcare system. So this all kind of has stemmed from the current state of the healthcare system. If you do some, research on it, you may come up with some buzzwords like uncoordinated or fragmented to describe it. So this is really all in an effort to alleviate this for the next generation of healthcare leaders. There's also a lot of discussion in the clinical setting regarding like referrals with other professions. So as an optometrist, it's really likely that you might have a patient who has low vision. And this patient might also be working with an occupational therapist. So at least while you're with us, you're going to get exposed to the work that an OT does and hopefully feel more comfortable collaborating with them in the future. So I'd love to kind of pass it off to our current students to share their experience with these IPE activities. Now, I will preface and say that these are mandatory for first-year students, but our second and third-year students and fourth-year students are a little preoccupied with like clinical commitments at that time. So they become optional as it comes later into their program. But I'd love for you guys to share some of the experiences you've had participating in IPE, if you could.
Sure. So one of the first IPE events that we do actually involves everyone from all the different programs kind of filling out a sheet at the beginning of your first year. And that sheet will ask questions really about what your profession is able to do and kind of the scope of your profession. And then what we were able to do is all meet as a group. You meet with like one student from each program. So, at your table, it might be an optometry student, a PA, an OT, maybe an acupuncturist. And you all kind of go around and talk about what your program specifically can do. So that was really a unique experience to learn a little bit more about what optometry could do, as it was, I think, our second month in the program. So it was still some of the things I was learning myself. But also be able to kind of learn what other professions are able to do, kind of learn where we might be able to interact, or we might be able to like refer to other programs. So kind of just bridging that gap between our programs.
Yeah, so the other one that I did, it's like at the summer of our first year. So I guess 2-ish years ago, it was online because everything was still kind of COVID back then. But we also were in like groups of like 5 or 6 people, and then we all had to kind of come up with the different solutions and like treatment management plans for a patient with undergoing like an opioid overdose. So it kind of related like how different professions such as optometrists and dental hygienists, pharmacists, and so on all have a different role in the way like management and treatment and I guess like the approaches to kind of combat the opioid crisis. Because at the end of the day, like different types of like these kind of crises are like seen in different professions. It's not just optometrists or just pharmacists. So it was a great opportunity to figure out like what as an optometrist can do and what their responsibility was in that situation.
Thank you guys for sharing. Yeah, since we've moved out of the COVID-y times, we have been able to do a lot more hands-on sort of IPE events. So the addiction type 1 that Samir had attended has now transformed into a Narcan training, where it's more like learning about like emergency medicine and such. We've also done a dementia awareness sort of simulation where our students were paired with some different tools that impaired like their vision and the feeling in their hands and feet, so that they could kind of feel like what it was like to navigate life with dementia. And we've also more recently done a diabetes training as well. All of these kind of focused around the idea that no matter which profession you come from, you're going to encounter patients who have maybe struggled with addiction or who have dementia or diabetes. And just best understanding from your perspective of your area of expertise, how you can provide intervention for these patients does go a long way. And also understanding how like your fellow colleagues from these different professions can also help support the well-being of your patient. So that's just an idea of some of the few things that we have done over the, 3 years since Samir's time and even beyond that. And we also have had some more one-on-one collaborations with some of the different professions, some of them that happen annually, such as with our PA students. We take a look at traumatic brain injury and concussion. So when you're working with the head as an optometrist, you need to best be able to identify these signs and provide intervention for your patient. So our PAs will help us as we identify those signs. In exchange, you guys will teach them how to use a slit lamp. So there's something that can be learned from everyone there. We've also done a case study with our pharmacy students where we looked at like artificial tears to treat dry eyes and found that like each profession had a different recommendation. So that was a nice one to find some common ground between the two professions at that. So there will be ample opportunities for you to collaborate with these other professions while you're a student with us. So sort of getting into the meat and potatoes now, we're going to focus our gears on the Doctor of Optometry program specifically. So this program does launch a new cohort every year in September, and it is a 4-year program. You do have the unique opportunity to tack on a Master of Public Health simultaneously with your optometry program, sort of a buy one, get one deal at that. And it's just an online class. There's just one additional course it's online that gets added to your program once a semester. So you at least get your first year to get your foundation and really commit to taking the MPH for the remaining portion of your program. So you can really flesh out if this is something that you can tackle at that. But it is, a legitimate MPH program. It ends in a thesis project, but it is a great opportunity to add to your credentials if you're looking to go into like education or access and advocacy. That being said, if you don't want to pursue the MPH and really just wanted to focus on your optometry program specifically, the MPH is available for you under our alumni scholarship, which is a 50% off tuition scholarship once you graduate. And in addition to that, there's other programs that fall under that scholarship as well, such as an MBA in healthcare management. There's also a Master of Clinical Research, Master of Clinical Management. Those are just like a snapshot of the ones that are available under the alumni scholarship. So your degree will still get you opportunities to pursue additional graduate studies if you would like. Now, with that, I'd also like to point out some statistics at the bottom of the slide in regards to our residency match rate. So more recently, we've seen a 26% match rate with students for an optometric residency once they graduate. So of course, to become an optometrist, you don't necessarily need to do a residency, but these programs can lead to some really great opportunities to working in a specialty or teaching or working in a VA facility, because it really hyper accelerates your resume to seeing multiple years of patients in one. So it is a really great opportunity at that. And the reason why we've had such a strong success rate with matching students to an optometric residency above the national average is because we have an extremely comprehensive clinical education here. A lot of that has to do with the population of patients that you're serving. So here in Worcester, we are known as a sanctuary city. And what that means is that the city helps immigrants and refugees from all areas of the world come to the city and find housing, jobs, and ultimately healthcare services. So a lot of those individuals end up seeking services from our students in our optometry program, because we not only have our on-campus clinic, but we also have 3 community health centers in the area. So they will make appointments with our students, and we'll see a large variety of patient cases that are showing ocular diseases and pathologies that present in all sorts of different areas of the world. So you're really going to be exposed to a lot of different scenarios and to all types of different ocular health when you're going through our various clinics. So with that, it really gets you comfortable in a clinical setting, and you get exposed to a large variety of patient cases at that. but it's special work for sure. A lot of the time you are, maybe the first patient, the first doctor that this patient has ever seen. So it goes a long way in supporting these individuals. And yeah, so with that, I would say too that there's 30 different languages that are spoken in the city of Worcester. So it is common that your exams are not going to be in English. However, we do have some really great, I always want to call them translation services, interpreters that help students when they are doing these various exams. So you're giving a proficient exam at that, very thorough still. And these interpreter services go beyond what Google Translate can provide for you, and that there's a bunch of different languages from even remote areas of the world that it's be able to translate for you. I'd love to ask Samir what his experience has been like with these interpreter services and how he's been able to see patients in our various community health centers, if you wouldn't mind, since you've been going through the paces in year 3.
Yeah, so as Hannah mentioned, there's like a variety of different languages. The first time you're actually at one of the community health centers is the summer of your second year, so going into third year. So I guess a little bit less than a year ago, I started at one of the community health centers. My very first patient there took me almost 4 hours because they were speaking Nepali and I had to use like an interpreter. And honestly, it was an experience because I was kind of confused, like why the exam took that long. But then at the end of the day, like this patient, unfortunately, it was like their first eye exam. So they had like several different like ocular diseases that they were presenting with. And then again, language being a barrier was also a situation. And then my first time being at the community health center. So it all kind of played a role at there. But then with that, at the various different community health centers that I have been through the past year, I've mainly experienced a lot of like Spanish speaking, Portuguese, a lot of different like African tribal languages I've actually experienced a lot, and then Haitian Creole. So with that, with those different populations, you are expecting to see like very like ethnic related diseases that are only seen in that subset of populations, which is kind of cool because we are taught these specific diseases in class in a specific demographic. And then seeing them in a specific patient sitting in your chair, it's kind of cool because it's like a full circle kind of moment.
Awesome. Thank you so much for sharing. Yeah, it's definitely a unique opportunity to go through our community health centers and work with this patient. It's very special to give back to them, but also it is neat to see these different sorts of ocular diseases that come through our door. And like I said, that's really attributes to how strongly our students have been with getting matched with an optometric residency, because that's ultimately what these residencies are looking for, is the strongest clinicians possible. So we're really going to test you and have you hitting the ground running when you come through our clinics, all for the best reasons, of course. So next, I want to kind of talk to you a little bit more about some of the features of our optometry program, and then we're going to break things down year by year. So one of the great features of our program is that we have quite small class sizes. We're one of the smaller optometry programs that are out there. So your cohort's going to be around 64 students, and it's further broken down into 16 students per lab. So our faculty are able to provide a lot of individualized attention to our students. You're not just a name on a roster to them. They're really going to know not only your name, but who you are and your own unique sets of strengths and weaknesses that you bring to the table. So I'd love to pass it over to our students and kind of ask them what their experience has been like with communicating with our faculty. Have they generally been approachable? How has been your rapport with them? Have you found them helpful when you have to go to them for extra support and whatnot?
Yeah, I would say those lab opportunities are definitely great to get to know your professors a little better. I know it says on the slide 1 or 2 faculty per lab. I've never had a lab with less than 2, and I've had multiple labs with 3. So it really just goes to show you that these professors are willing to kind of, work one-on-one with you. Having that cap at 16 students, and usually you're practicing on each other. So one student will be acting as the doctor, the other one as the patient. So really it's 3 professors for 8 doctors. So that kind of just gives your perspective a little bit more of how individualized that patient care kind of is in that learning aspect. Also, the availability of our professors is definitely something that is just kind of above and beyond. When you're learning some of these skills, they require a lot of practice to kind of make them muscle memory. So we have professors that'll come in from 7 to 9 p.m. just for you to practice, or they'll come in on Saturdays and Sundays just for the students to come in and ask questions, do those skills one-on-one, really just going above and beyond for the students to make sure that they're understanding those skills. So I'd say the lab is a majority of where that interaction is, but even just as simple as having a question during a class or going to their office hours, they truly are extremely accessible.
Thank you so much, Sierra. I think it's also important to note too that outside of our faculty, we do have ample support to offer our students as well. One being through our Center for Academic Success and Enrichment. You guys not only have counselors, but also peer tutors that are available for you free of I guess, no cost, free. And with that, you can talk to a peer tutor who is an upperclassman student in your program, and they can kind of help walk you through, anything that you needed additional clarification on. And it's nice to have that opportunity too, because, sometimes you might have trouble having something click in your mind, and talking to someone who's been through that before and understands it as a student would, to sort of describe it to you in a way that makes sense, can go a long way with getting those gears turning. So that's something that's available to our students. We also have different career services available and alumni support. So there's a large variety of ways that we can support you while you are with us. So next, I'm going to have you guys go through each year of the program, starting with Sierra on year 1. What can you tell us about what our prospective students can expect in year 1 of the program?
Sure. So your first year is really pretty heavy on that classroom aspect and the lab aspect. So your first couple semesters, you'll take 3 labs with classes with that, obviously, and you're really learning a lot of those fundamentals. So those can be anatomy classes, histology, optics, immunology, kind of learning a little bit more of those fundamentals, those basics, kind of preparing you to dive into the deeper kind of subspecialties. So you do a lot of those entrance skills testing. So if any of you guys are currently working as optometry techs, it might be some stuff that you're familiar with. Cover tests, pupils, EOMs, really just learning how to do the beginning part or an entrance to your eye exam. And you're also going to get a chance to observe the second years while they're in the clinic. So we do have the clinic kind of going all the time. So you'll have the opportunity to go in at least once a semester, but you're more than welcome to stop in more than that if you'd like, and get to watch kind of an exam go from start to finish, and watch it from kind of both the patient perspective, because you'll get a chance to actually be a patient in the EVC, and then also just kind of watching the second year and how they do their exam. And then for year 2, which I'm currently in, you're obviously still taking those classes. You kind of move down to less labs, but you're also introducing that primary care clinic. So this is anything from people needing an update on their glasses prescription to someone coming in with a red eye. And you're really getting a chance to use all those skills that you learned in your first year, and you're doing an exam from front to back. So it can be a little intimidating at first to kind of jump right into that. But you always do have a preceptor who will go in and make sure you're on the right track. You're never working absolutely alone. We also have the opportunity to scribe for each other. So it is really helpful to kind of have that collaborative environment. And honestly, I think it's one of the better ways to learn, is to kind of throw yourself into a deep end a little bit, but have that professor able to kind of help you out and kind of help you through that critical thinking aspect of the exam. In terms of classes, you'll be taking a little bit more focused on the eye. So right now I'm taking contact lens, glaucoma, binocular vision, posterior segment of the eye. So you're learning more about these individual aspects of the eye.
Would you be able to share a little bit about the school screenings that they can anticipate in year 2?
Sure. So we do have a partnership with Worcester Eyes. And with that, we actually go to different elementary schools, middle schools, high schools, and we'll provide school screenings for them. So this is kind of a fun opportunity. I like the school screenings, but you're basically doing that entrance part of the exam that I mentioned before that you're learning in year 1. And you'll do those for all the different high schools. I've worked with anyone from kindergarten to seniors. And you're seeing, do they need a refractive change? Are they having trouble with their binocular vision? And then if they do end up failing that screening, we actually offer them a free eye exam at the EVC. So it is kind of a nice opportunity to give some of the school system a little bit of a break. I know a lot of the nurses appreciate it, but also give us a little bit more of that practice. And then the other thing I'll mention quickly is the optical rotation. So you'll have an opportunity to work in the optical as well. So you'll help actually fit people with glasses and learn a little bit more of the insurance side, a little bit more of the fashion side of optometry. And usually you do that about 2 to 3 times a semester.
Great. Thank you so much, Sierra. And now I'd love to pass it off to Samir to take us through year 3 and what he is anticipating for year 4.
So in third year and beyond, you're starting off more so in like specialty clinics. So you're still doing primary care, as Sierra did mention, from second year, but those eye exams are mainly done at the community health centers, which we did mention earlier. What the specialty clinics that the school does offer is mainly a high focus on glaucoma and contact lens. We also have a bunch of binocular vision, low vision, pediatrics, and anything else in between offered too. Basically, you're kind of split off into like halves in your classmates. So half of you guys will be in contact lens clinic one semester, and the other half will be in glaucoma, and then you switch the next semester. So this semester, currently, I'm seeing patients in contact lens clinic, and then here and there with low vision, whereas last semester was more so pediatrics, binocular vision, and glaucoma. With contact lens clinic this semester, I've seen a range from like teaching people how to put contact lenses on and off, and then from all the way to like specialty contact lens fits, treating like eye to ocular surface diseases, keratoconus, and pretty much making like a big difference in these patients' lives because many patients with severe ocular diseases are not seeing well. And then once you fit them with like a specialty contact lenses, they're going from seeing nothing to seeing 20/20. So it is like a very like rewarding kind of situation. And these patients will like love coming and seeing us over and over again. So it is a great opportunity that the school does offer. And given the different population that is found within Worcester, they have certain ocular conditions and diseases that like specialty contact lenses are most notably used for. So it is a great way to kind of like connect what you're learning in class to like a clinical application.
And then, of course, you prepare for your national board exams.
So with that, the school does have a specific Part 3 national boards room. It's basically has all the different equipment available that you will see when you do take Part 3 of national boards in North Carolina in your 4th year. Prior to that, the school does offer various different kind of resources available to study for Part 1 of national boards. So I just took Part 1 of national boards yesterday, and my classmates took it today and the rest of this week. The school does prepare you really well, and like they know that there are different resources available, and as well different faculty, professors, anyone who is available, they'll guide you the way to understand in places you are struggling with. So it is like a great resource the school does offer with different programs, the faculty, even your own classmates are also a good resource because some students may have understood the concept better when they were taught originally in first or second year, and they could probably make you re-understand or like refamiliarize yourself with the different concepts that are available. And then you kind of take part 2 sometime between your 4th year, and then you take part 3 anytime after you take part 1. So the plan is to take part three, sorry, this August, and then part two sometime in December. With that being said, with fourth year, it's 3 16-week externship rotation sites that are available. We have sites available from as far away from Alaska to California to Florida, and a lot more scattered within the New England area, as that's where Worcester is located. With that, there's like a whole lottery system process that's available. But at the end of the day, I haven't met anyone who did not get their top choices. So school does like try their best to offer the students the best options that they want available. And then again, with that, in your fourth year, there is the opportunity to look into residencies, because by then you're more so like figuring out like what you want to do after graduation. Again, residency isn't mandatory, but it is an option available, and most fourth years start that process within fourth year on the rotations. And then finally, after every like rotation semester or rotation site, every 16-week, there's like a capstone kind of project that's available. So you're kind of presenting like a big case at the end of each of the 3 rotations to your classmates, and some faculty may join in as well. You're presenting like how a patient came in, and then what eye exam techniques were done, and then what the concluding diagnosis and treatment plan was. So a lot goes on in fourth year. Of course, there's no classes, but like you're pretty much working as a regular student optometrist, 8 to 5, Monday to Friday, sometimes even the weekends. So it's a great learning experience that is offered in your fourth year.
Great. Thank you guys so much for taking us through that. That was very detailed. So I want to discuss a little bit more about the amenities that you can anticipate on having available to you throughout our program. So of course, we have a fully functional state-of-the-art clinic on campus, our Eye and Vision Center. And in the same building, we do have an optical store that has like a full range of, so we have a full range of services that are available to our patients just within our on-campus location in Lincoln Square in Worcester. In addition to that, we have our 3 community health centers, one in Worcester, one in Framingham, and one in Milford. So those are 3 different locations within like the Worcester County area where you'll see patients from a wide range of backgrounds. In addition to that, we have 24/7 access to our preclinic facilities for you. So you're able to go practice exams on each other through all hours of the night if you wanted to. Other facilities that we have for you include our VR Magic BIO room, our binocular indirect ophthalmoscopy simulation lab. So this like simulates looking into the back of the eye through VR. It does use real imaging, so you're able to identify like different diseases quite easily when you're actually doing it in real deal, because it's not like an animated image at all. But it's easy to have this simulated setting to practice that skill rather than having to have one of your classmates, dilate their eyes for half the day. So that's something that you can definitely hone in on your skills with. We also have more recently our Board 3 room, as Samir mentioned. So this is a new addition to our program where we really mimic all of the equipment that they have down there in North Carolina that students will experience when they take part 3 of that board exam. So if you're not super familiar with part 3, everyone in the country that's an optometry student does have to go specifically to North Carolina to take like a practical exam. So we have all the, equipment and other devices that you could anticipate on using for that exam, and our preceptors and faculty will run through practice exams with you just to get you comfortable and anticipating what you can expect specifically for that part. And we have seen quite a big difference so far with our students feeling more comfortable and confident going into part 3. So we're really excited about that. And I mentioned research previously. So when I did mention that, we have a great partnership with UMass Memorial Medical Center's ophthalmology program. So we have had students work on different mouse models over there that have like different retinal diseases. So we've had some even present posters on their research. But in addition to that, there is plenty of opportunity to collaborate with our faculty because it is a requirement for our faculty to continue to participate in research to some extent. So if there's something one area of optometry that you're truly passionate about, we can certainly pair you with one of our faculty members to work on some sort of project in that area. I would like to ask Sierra if she could talk a little bit about the research that she helped one of her fellow classmates with recently, as we are sort of one of the clinical sites for this new prism lens. Would you be able to talk more about that?
Sure. So that's the cool thing about research opportunities. So you don't just need to work with the professor. You can also be a volunteer. So I know that Dr. Han, one of our professors, she actually did research where she had students come in and she was testing basically their eye movements. So she did that by putting a VR system almost on them and then had them read from a paper. And that was part of her research. And then I actually worked with one of our students, Miriam, who's working for Dr. Deliso, and they work with low vision. So they're working with patients who are actually missing their vision on half their visual field. So they can really only see in the middle of their vision. And they're using these lenses known as peliprisms, which are basically able to shift their view so that they can see more of their visual field. So I did a little bit of, I like to call it the modeling aspect. So I tried it on and was able to kind of get the form of where they want to put, the lenses on the patient, where they should be in relation to the glasses and the pupil. And they're working with Harvard and Mass Eye and Ear. So kind of getting that chance to work with patients all over. And as Hannah mentioned, our Eye and Vision Center is one of the sites that patients can come in. And the coolest thing about this is assuming that their research is successful, the patients will actually be able to leave with those prism glasses, and it'll provide them real substantial changes in their vision and just being able to complete activities of daily living. So it is really impressive to see that these research opportunities aren't just stuck at a lab bench. They're really kind of being implemented into daily use and in real patients.
Perfect. Thank you so much, Sierra. That was really interesting. Described it better than I could have with my non-optometry expertise. So I appreciate hearing it from you. So needless to say, if research is something that you're interested in, we have plenty of opportunities for you to get involved. So now that we've kind of covered all of the various aspects of our program and our institution, hopefully you'll think about submitting an application pretty soon. So I want to just detail what that entails exactly. So all of our applications go through the OptumCAS system. So this is a centralized application system, and you will have to send in all of your official transcripts to OptumCAS, as well as an official OAT or GRE score. So when I say all official college transcripts, I mean all of them. So even if you did take just one random summer course at a community college, that will need to be included in your OptumCAS application. We don't necessarily require a bachelor's degree, although it is preferred. For students who don't intend to complete a bachelor's degree, you do need to have at least 90 college credits before transferring over. And speaking a little bit about the standardized test requirement. So like I said, we do require either the GRE or the OAT. The OAT is more slightly preferred from the committee just because it is the optometry admissions test. So it is specifically geared for aspiring optometrists. And with that, there's a lot of data that backs, a student's success in the program. So the committee really relies on those scores to assess a student for entry into the program. So if you're considering either of those, we typically prefer to see the OAT. On the OAT, we like to see a 300 academic average in total science. That's what you should really aim for. And then for the GRE, we like to see scores in the 50th percentile range. Now, students ask me all the time if we require any sort of experience prior to applying. The answer is no, but we do definitely strongly recommend it for a variety of reasons. Well, it's not going to make or break you earning an interview for the program if you don't have any sort of experience, working in an optometry office or shadowing or whatnot. It does become really important when it comes time for your interview and being able to speak to, your passion for optometry, and your understanding for the career. So I highly recommend that you do get some experience before submitting your application. Also, kind of with the analogy, if you're going to buy a car, you want to test drive it. Same goes for your career. So that's another reason to consider getting some experience ahead of time. So we do have a variety of prerequisite requirements that are listed on our website. So if you wanted to see a complete list of required courses, those are available for you there. We require, general chemistry 1 and 2, biology 1 and 2, physics 1 and 2, organic chemistry, microbiology, a couple of English electives, psychology, calculus, and statistics. I think I covered them all. So if you wanted to see a complete list as well and refer back to it, that's on our website at mcphs.edu. And in addition to that, if you do have any prerequisite courses that are outstanding, you can still apply with them in progress. However, just note that all courses do need to be completed by August 15th. That's really the deadline. So as long as you're able to complete those courses before term start, you're welcome to apply. But with that, we do require a grade of a C or higher, preferably higher, for those prerequisite courses. One other application requirement includes a letter of recommendation. We do require just 1 letter of recommendation, although 2 or 3 are preferred. These should be professional in nature, meaning that they're coming from like an academic background or a professional background from like a supervisor or manager. So those are some areas that you should really look for. They don't necessarily have to be from an optometrist, but if you have worked under one, that is a great person to appoint to write you a letter of recommendation as well. And if you have any international coursework, not including study abroad, if you studied abroad, we don't need you to go through and get an evaluation for that. But for those of you who have completed a good amount of coursework abroad, we do need a international transcript evaluation through either WES, which is World Education Services, or ECE, which is Education Credential Evaluators. So those are the 2 services that we will accept, and they're essentially going to evaluate your credits to a US equivalency, so we can see if we can accept any sort of transfer credit and really assess the coursework that you did complete. So this is required for all institutions outside of the US except for English-speaking Canadian institutions. And lastly, we do interview by invitation only. So if you meet our requirements, you can expect to receive an interview invitation. So a couple details about the application process. I do want to emphasize to apply early, and that reason is we have rolling admissions. So we have limited seats at that. As we receive applications, we review them and offer seats. So as we're getting later into the cycle, seats are starting to become limited, which is why we preach to apply early at that. May 1st is our application deadline, but the cohort could be near capacity at that point. We do anticipate on doing interviews from September through May each year. In addition, we review applications depending on their GPAs, of course. We're not only going to look at your cumulative GPA, which is calculated by OptumCAS, but also your total science GPA, which is also calculated by OptumCAS. And those GPAs are going to include a rolling count of all the coursework that you've completed, including failed or repeated coursework. So just keep that in mind. Whereas we ourselves will calculate a prerequisite GPA for you. So the prerequisite GPA is just the highest grade earned in the prerequisite specific coursework. So all of these should be above a 3.0. That's what you should shoot for. We also like to see applications who have expressed an interest and a motivation for wanting to pursue optometry. You got to be passionate about the career that you're looking to pursue. And like I said, again, timing of the application is everything. So touching on just financial aid here, all domestic students are eligible to apply to FAFSA. They have Grad Plus loans that offer some really good benefits to students. And then that is our FAFSA school code that's listed there. I don't anticipate you guys to take this down at this time, but if you do Google it in the future, just know that it is the same code for all MCPHS campuses. We do have tuition and fees published on our website. So if you wanted to explore those are published for you to see. But just note that we do give merit scholarship awards out of up to $12,000 a year. So that merit award, that tuition amount that is listed on our website might be a little bit different when you're also considering the merit scholarship that you could get when accepted into the program. And we do have affordability appointments that are available to students. So if you do want to sit down with our student financial services team and really flesh out, what the program is anticipated to cost you on a year-to-year to semester-to-semester basis, and talk about some ways that you can finance your education, we do offer those through our student financial services team, and they'd be more than happy to meet with you or talk to you over the phone, email with you, or meet with you over Zoom. So I will make sure that I can share some information with you when you are accepted into the program to start planning. And last but not least, I have some contact information for you guys that I'm going to paste in the chat. Now is a really great time as well to start submitting any final questions that you might have in our Q&A. We have a couple of minutes to address any additional questions that we didn't cover. But while I paste these into these links into the chat, I do want to let you know that we're going to be hosting a open house on Saturday, April 27th. So if you are available, we'd love to see you. It's going to include a guest speaker that was a graduate from our optometry program. We're going to have various refreshments and swag items, and we're also going to have students and faculty there to do some demos with you guys. So if you're available, the link to our open house is actually on that link for the campus tour. So mcphs.edu/visit/graduate. So hopefully you're free that upcoming Saturday, April 27th, and we'll see you in person. So make sure to save on to those links if you can. But let's get over to some questions that we've received. Looks like we got a couple from a prospective international student. I can let you know that international students would be under an F1 visa, and the prerequisites are the same for all international students. So the same ones that are listed on our website there do apply to international students as well. We do rely on the WESR ECE evaluation to see if we can give you any potential transfer credit for what you completed internationally. So I would suggest that you get that evaluation before you start the application process. Another question comes in about the OAT scores. They're asking if a 300 is acceptable. We can consider scores under a 300. So it really is sort of a balancing act when we're looking at applications. If you were a really strong academic, but didn't do as well on the OAT, we could potentially move forward with some slightly lower scores. So if you don't score exactly a 300 and are slightly below, I would still encourage you to apply, and we can certainly assess your application as holistically as possible. And, we'd love to see it. Tuition and fees is the same for international students. We are a private institution, so no matter if you're an in-state or out-of-state student or international student, our tuition and fees are all the same. And I guess the last question that I got asks if MCPHS superscores the OAT. We do not superscore the OAT. This is, we take the highest overall score. So if you got 10 points more on your academic average your second time around, then we would take the second score that you received. Great. So it looks like we cleared out the Q&A. So we must have answered all of your questions for you this evening, and we're right on the hour, which is perfect. So I want to thank you guys all for attending and listening to us share about the program today. It was nice chatting with you all, and also nice hearing from our current students. I always learn something new from you guys, and I know that you are particularly busy. Sierra's got some big exams coming up next week, and Samir is finally relaxing after taking part 1 of his board exams. So, thank you guys for making the time to speak with us. Again, I included all these links in the chat. So if you want to save those before we sign off today, that would be great. But that is all that we have for you. My contact information is also linked in the chat, so please feel free to reach out to me at any point if you have any questions. But that's all that we have for you today. And thanks for joining us, and take care. Bye.